My name is Brian Sullivan, and I'm an emergency room nurse at Methodist Hospital in Gary, Indiana. I've been doing this for 11 years now, and in that time, I've pronounced 63 people dead. I remember the first one clearly, a 74-year-old woman who coded after a stroke. I remember the last one too, because it was 2 nights ago, and I'm not entirely sure he actually died. I work the night shift, 11 to 7, which means I see things most people don't. Not ghosts or anything like that, just the reality of what happens to human bodies when they fail. Heart attacks at 3 in the morning, diabetic comas, overdoses, car accidents on the I-90 when the road's ice over. You develop a clinical distance from it. You have to. But what happened with James Kowalski broke through that distance, and I haven't been able to rebuild it since. It was a Tuesday night in early March, cold outside, that wet kind of cold that gets into your bones. The ER was unusually quiet. We'd had a psych eval earlier, a sprained ankle around midnight, but nothing major. I was restocking supplies in Trauma Bay 2 when the ambulance radio crackled. Male, mid-50s, found unresponsive in his apartment by a neighbor. No pulse, no respiration. They'd been doing CPR for 18 minutes. 18 minutes is a long time. After about 10 minutes without oxygen, brain damage becomes almost certain. After 15, you're basically working on a body, not a person. But we don't make that call in the field, so when the ambulance backed into the bay at 2:47 a.m., we were ready. The paramedics wheeled him in. White male, balding, wearing a stained undershirt and boxers. His skin had that grayish-blue tint that means poor circulation, probably for a while. Greg Chen, one of the paramedics I'd worked with for years, was still doing compressions. His partner, Lisa Martinez, was bagging him, forcing air into his lungs. Dr. Jennifer Hayes took over the code. She's been an attending for maybe 3 years, sharp as hell, never flustered. We transferred him to our gurney and I took over compressions while the respiratory therapist, Mike, intubated him. Another nurse, Karen Williams, got IV access and started pushing epinephrine, standard ACLS protocol. We ran it by the book. I compressed his chest for 4 minutes straight. You count them, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, trying to maintain at least 100 compressions per minute. His ribs felt soft under my palms, which probably meant osteoporosis or previous fractures. I could feel them flexing with each compression, that disturbing give that tells you you're doing it right, but also doing damage. Dr. Hayes checked the monitor. Asystole, flatline, no electrical activity at all. Continue compressions, she said. Push another EPI. We worked him for 32 minutes total. That's longer than usual, but Dr. Hayes is thorough. And there was something about this guy, some desperation in the way we all kept going. Maybe it was the photo someone found in his wallet, him with 2 kids at a baseball game. Maybe it was just that the ER was quiet and we had the time. Finally, Dr. Hayes called it. Time of death, 3:19 a.m. I stepped back from the gurney, my arms aching. Mike removed the breathing tube. Karen turned off the monitor. Standard procedure. We'd contact the coroner, notify next of kin if we could find them, and eventually the body would go downstairs to the morgue. That's when James Kowalski opened his eyes. I saw it first because I was standing right next to his head, stripping off my gloves. His eyelids just lifted, not gradually but all at once, like someone had flipped a switch. His eyes were brown, bloodshot, with pinpoint pupils that didn't react to the bright overhead lights. Dr. Hayes, I said, my voice coming out strangled. She turned, saw him, and froze for maybe half a second. Then her training kicked in. Get the monitor back on. Check for a pulse. Karen reattached the leads with shaking hands. I put my fingers on his carotid artery, pressing into the warm skin of his neck. Nothing. No pulse. I tried his wrist. Still nothing. The monitor showed a systole. Perfect flatline. But James Kowalski was looking at me. His eyes tracked my face, followed my movement when I leaned back. His chest wasn't moving. No respiration at all. But his eyes were alert, focused, undeniably conscious. I don't have a pulse, I said. My mouth was dry. Monitor shows a systole. But he's tracking. Dr. Hayes leaned over him. Mr. Kowalski, can you hear me? His eyes shifted to her. He didn't blink, didn't move anything else. Just those eyes watching her with an expression I couldn't read. Not afraid, not in pain, just watching. Get me a portable ultrasound, Dr. Hayes said. Mike, check his airway. Mike carefully tilted James's head back, shining a pen light into his mouth. Airway's clear. No gag reflex. He waved his hand in front of James's face. The eyes followed the movement. Jesus Christ. The ultrasound confirmed it. No cardiac activity. His heart wasn't beating, not in any rhythm we could detect. The chambers were still, blood pooling in the ventricles. Dr. Hayes ran the probe over his chest 4 times, checking different angles, but the result was the same. No heartbeat. Check the femoral, she said. I pulled back the sheet and pressed my fingers into his groin, feeling for the femoral pulse. It's one of the strongest pulses in the body. If the heart's beating at all, you'll feel it there. Nothing. His eyes were still open, still tracking. He watched me touch his leg, watched me shake my head at Dr. Hayes. Run a strip, she said. Get a 12-lead EKG. We attached the electrodes. The machine spat out a perfect flat line across all 12 leads. No P waves, no QRS complexes, no T waves. Nothing that indicated any electrical activity in his heart at all. But James Kowalski was still watching us. Dr. Hayes stepped back. I could see her trying to process it, running through differential diagnoses, equipment malfunctions, anything that could explain what we were seeing. Check the leads again, she said finally. Make sure they're attached properly. I checked them. They were fine. Reboot the monitor. Karen powered it down, waited 10 seconds, powered it back up. Same result. Flatline. Try a different monitor. We wheeled in the backup unit from Bay 3. Different machine, different cables, different electrodes. I attached them carefully, making sure each one had good contact with his skin. Flatline. James blinked. It was the first time he'd blinked since his eyes opened, and we all saw it. A slow, deliberate movement of his eyelids. Then his eyes focused on me again. Mr. Kowalski, Dr. Hayes said, her voice remarkably steady. Can you move your hand if you understand me? We all watched his right hand. It didn't move. His fingers were pale, slightly curled, resting on the white sheet. No movement at all. But his eyes shifted to his hand, then back to her face, like he was trying to tell us something. Mike checked his oxygen saturation. The pulse oximeter couldn't get a reading. It needs a pulse to work. He tried different fingers, different sensors. Nothing. I'm not getting any perfusion, he said. Draw blood, Dr. Hayes ordered. Karen tried. The blood that came out was dark, almost black. Venous blood that had been sitting still too long. It moved sluggishly into the tube, more like syrup than liquid. She handed it to Dr. Hayes, who held it up to the light. It didn't move when she tilted the tube. It just sat there, viscous and wrong. Send it to the lab anyway, Dr. Hayes said quietly. CBC, CMP, troponin, everything. I was still watching James. His eyes hadn't left my face. There was something in that gaze. Not pleading, not afraid, but aware. Definitely aware. He knew we were there. He knew something was wrong. Sir, I said, and I don't know why I bothered. Just hang on. We're trying to figure this out. His pupils constricted slightly. Just a millimeter, but I saw it. That's impossible without a functioning brainstem. Pupillary response requires neural input, oxygenated blood flow, working muscles. He had none of those things. The EKG said his heart wasn't beating. The ultrasound confirmed it. His blood wasn't circulating, but his pupils responded to me speaking. Dr. Hayes pulled me aside. Mike and Karen stayed with James, checking vitals that didn't exist, running through procedures that made no sense anymore. Brian, Dr. Hayes said quietly, have you ever seen anything like this? I shook my head. Never. Not even close. Neither have I. She glanced back at him. But he's not dead. I don't know what he is, but he's not dead. What do we do? She took a breath. We treat him like he's alive, because I think he is, somehow. We admitted James Kowalski to the ICU. I've never admitted someone with no pulse and no heartbeat before. The ICU nurses thought it was a joke until they saw him, saw the monitors, saw his eyes tracking them around the room. Dr. Hayes called in Dr. Robert Foster, the head of cardiology. He arrived 20 minutes later, still in his pajamas under his coat, probably thinking this was a prank. He examined James personally, checked the monitors, ran his own ultrasound, drew his own blood. I watched his expression change from annoyed to confused to deeply unsettled. "This isn't possible," he said finally. "His heart isn't beating. His blood isn't circulating. His brain shouldn't be functioning, but he's clearly conscious." "So what is he?" Dr. Hayes asked. Dr. Foster didn't answer. He just stood there, staring at James, who stared back. The lab results came back around 5:30 a.m. They didn't make sense. His lactate was through the roof, indicates the body isn't getting oxygen and is breaking down. His pH was dangerously low, metabolic acidosis, usually fatal. His potassium was high enough that his heart should have stopped, except his heart already had stopped, according to every test we could run. But he was still there, still watching, still somehow alive. I stayed 2 hours past my shift. I couldn't leave. None of us could. We stood around his bed, checking him every 15 minutes, looking for any change. His temperature dropped to 89 degrees Fahrenheit. His skin turned gray-blue. His fingers and toes showed signs of peripheral cyanosis, no oxygen reaching the extremities, but his eyes stayed alert. At 8 a.m., Dr. Foster called in a neurologist, Dr. Linda Peterson. She ran an EEG to check his brain activity. She placed the electrodes on his scalp carefully, professionally, but I could see her hands shaking slightly. The EEG showed delta waves, slow waves that usually indicate deep sleep or unconsciousness, but they were regular, rhythmic, organized, not the chaotic patterns you'd see in someone dying, not the flat line you'd see in someone brain dead. "He's sleeping," Dr. Peterson said, sounding bewildered. "According to this, he's in slow-wave sleep." "But his eyes are open," I said. We all looked at James. His eyes were still open, still tracking, but the EEG said he was asleep. Dr. Peterson ran the test twice more. Same results. She checked the machine. It was working fine. She'd used it on another patient that morning with normal results. "I need to review this with colleagues," she said finally. I need to think about this." She left. Dr. Foster left. Dr. Hayes stayed, sitting in a chair beside James's bed, watching him. I should have gone home. I'd been awake for 26 hours. But I stayed too. Around 11 a.m., his eyes closed. It happened slowly this time. His eyelids lowered gradually, like he was fighting sleep and losing. When they finally shut, he looked peaceful. Dead, but peaceful. "Check his pupils," Dr. Hayes said. I lifted his eyelid gently. His pupil was fixed and dilated. No response to light. I checked the other eye. Same thing. Dr. Hayes checked the monitor. Still flatline. She did an ultrasound. No cardiac activity. She checked for a pulse. Nothing. "I think he's gone," she said quietly. "For real this time." We waited. 10 minutes. 30 minutes. An hour? His eyes stayed closed. His body cooled further. The monitors showed nothing. At 12:43 p.m., Dr. Hayes pronounced him dead. Again. This time, he stayed dead. The autopsy report came back 3 weeks later. I requested a copy, which is unusual, but Dr. Hayes arranged it. I needed to know. Massive myocardial infarction. His left anterior descending artery was completely occluded. The widowmaker, we call it. He'd had a massive heart attack, probably several hours before the neighbor found him. Time of death was estimated at around 10 p.m. the night before he came to us. That meant he'd been dead for approximately 5 hours before the ambulance even picked him up. The pathologist, Dr. Scott Andrews, noted something else in his report. Inconsistencies in tissue decomposition suggest possible periods of restored circulation, though no medical intervention is documented in patient records. Recommend further investigation. No further investigation was done. The case was closed. Cardiac arrest due to coronary artery disease. Natural causes. File it away. but I know what I saw. So does Dr. Hayes. So do Mike, Karen, and every person who was in that ICU room. We saw a man with no heartbeat track our movements with his eyes for 8 hours. We saw his pupils respond to stimuli despite no brain activity. We saw him exist in a state that every textbook says is impossible. I looked through old records. I'm not supposed to do that, but I have access, and I couldn't let it go. I found 2 other cases, one from 7 years ago, an elderly woman brought in after a drowning, pronounced dead, then opened her eyes, monitored for 6 hours with no vital signs before expiring again. The attending physician at the time, Dr. William Thompson, noted unexplained consciousness despite cardiopulmonary arrest, but offered no explanation. Dr. Thompson left Methodist 3 months later. I called him. He's now at a clinic in Fort Wayne. He wouldn't talk to me. Just said, "I don't discuss that case," and hung up. The second case was from 15 years ago, before electronic records, so I only found a brief mention in a cardiology resident's notes. Patient exhibited awareness post-mortem for approximately 2 hours. Unable to explain. Attending advised no documentation. No name attached, no follow-up. 3 cases in 15 years, all at Methodist Hospital, all in the ER or ICU, all showing the same impossible combination. No pulse, no heartbeat, no circulation, but clear consciousness. All eventually dying again, permanently hours later. I asked Dr. Hayes if she thought we should report it to someone. Medical journals, the CDC, somebody. "Report what?" she said. "That sometimes dead people are briefly not dead? That consciousness can exist without a functioning heart or brain? Who would believe us? And what good would it do?" She was right, but it bothers me. It bothers me that it's happened before and probably will happen again. It bothers me that I don't understand it. I'm a nurse. I'm supposed to understand how bodies work. But this breaks every rule I know. I still work at Methodist, still do the night shift. But I'm different now. Every time someone codes, every time we call a death, I watch their eyes. I wait for them to open. Most don't. But I keep waiting because now I know it's possible. Last month, I was restocking supplies in Trauma Bay 2, the same bay where we brought James Kowalski. The lights flickered just for a second. The monitor in the corner, the one that's always on standby, showed a blip. Not a heartbeat exactly, but something. A spike in the flat line. Then nothing. I checked it. The machine was off. But I saw what I saw. Sometimes I wonder if James Kowalski is really gone. His body was cremated, according to the funeral home records. But what left his eyes that day in the ICU? Was it him? Was it something else? And where did it go? I don't believe in ghosts. I don't believe in souls, not in the religious sense. But I believe what I saw. A man was dead, and then he wasn't, and then he was again. That happened. It's in the records, in the test results, in the memories of 6 medical professionals who all saw the same impossible thing. If you work in healthcare long enough, you'll see things you can't explain. Equipment that fails at critical moments. Patients who survive what should have killed them. Patterns that shouldn't exist. Most of us learn to file it away, to accept that medicine isn't perfect and human bodies are more mysterious than we'd like to admit. But some things won't stay filed away. Some things stay with you, changing the way you see everything that comes after. I've pronounced 43 people dead since James Kowalski, and every time just for a moment, I wonder if they're really gone, or if they're somewhere I can't reach, watching me with eyes I can't see, waiting to come back. I don't take breaks in Trauma Bay 2 anymore. And I never work there alone at night. There's something else I haven't told anyone. Something I found in James Kowalski's medical records from years before his death. He'd been seen in our ER once before, about 8 years ago. Minor complaint, chest pain that turned out to be nothing. Anxiety, they said, sent him home with instructions to follow up with his primary care doctor. But there was a note in the file from the nurse who discharged him. Just one line. Patient asked repeatedly if we were sure he was alive. Stated he felt wrong but couldn't explain. Referred to psych. Patient declined. I don't know what that means. Maybe nothing. Maybe James Kowalski had anxiety issues. Depression, Something that made him question his own existence? Or maybe he knew. Maybe he'd felt it before. That wrongness. That sense of being suspended between states. Maybe what happened that night in March wasn't the first time. Maybe it was just the first time someone else was watching. I've started paying attention to the patients who come through. Not just their vital signs or their injuries, but the things they say, the odd comments, the strange questions. Last week, a woman came in with a panic attack. While I was checking her oxygen levels, she grabbed my wrist and asked, "Am I real? Can you tell if I'm real?" I told her yes, of course she was real. Her pulse was strong and steady under my fingers. But after she left, I pulled her file. She'd been in 4 times in the last year, always at night, always asking variations of the same question. I don't know what to do with that information. I don't know if it means anything. But I wrote down her name, Patricia Henderson. I'm keeping a list now, not officially, just in a notebook I keep in my locker. Names and dates and the strange things people say when they think they might not be alive. Maybe I'm losing it. Maybe the stress of that night with James Kowalski broke something in me, and now I'm seeing patterns that don't exist. Maybe I'm turning into one of those healthcare workers who burns out and starts believing in conspiracy theories and medical mysteries that have simple, boring explanations. But I don't think so. I think there's something happening here, something that occurs just rarely enough that we can pretend it doesn't exist. Something that contradicts our understanding of life and death so fundamentally that we'd rather forget it than investigate it. Dr. Hayes won't talk about it anymore. When I tried to bring it up last month, she cut me off. "It's done, Brian," she said. "He died. That's all that matters. Let it go." But I can't let it go, because if James Kowalski could be dead and conscious at the same time, then what does that mean for everyone else? What does it mean about the nature of consciousness, of life, of the moment we call death? I'm not a philosopher. I'm not a researcher. I'm just a nurse who works the night shift in Gary, Indiana. But I know what I saw, and I know it's happened before, and I know it will happen again. The question is, what do I do when it does? Do I document it this time? Take photos, videos, anything that proves it's real? Do I call the media, risk my career and my credibility to get the story out? Or do I do what everyone else has done? Treat the patient, watch them die again, and file it away in the back of my mind where it can haunt me quietly? I don't have an answer yet, but I think about it every shift, every time someone codes, every time I pronounce someone dead, because someday someone's going to open their eyes again. And when they do, I need to be ready. If you've ever worked in healthcare and seen something you couldn't explain, something that made you question everything you thought you knew about life and death, tell me about it. Send me a message, email me. I don't care how crazy it sounds, because I need to know I'm not alone in this. I need to know that other people have seen what I've seen, and maybe, if enough of us come forward, we can figure out what's actually happening in those moments between life and death. Those impossible moments when someone should be gone but isn't. When consciousness persists despite every biological reason it shouldn't. James Kowalski died twice. The first time lasted 8 hours. The second time stuck. But somewhere in between, he was something else. Something we don't have a name for. Something that shouldn't exist but does. And I think he's not the only one. I think there are others. Walking around, living their lives, carrying that same wrongness James described 8 years before his death. That feeling of being not quite alive, not quite dead, suspended somewhere in between. And I think someday I'm going to meet another one, in my ER, on my shift. And this time I'm going to be ready. This time I'm going to find out what they really are.